Advanced bladder cancer occurs when the abnormal cells of a muscle-invasive tumor spread beyond the bladder lining. At this point, the cancer can metastasize or advance. This means that the cancer has spread to other parts of the body outside of the bladder. In some cases, bladder cancer can recur, meaning that the cancer returns after therapy or surgery. Recurrent bladder cancer is treatable, and treatments may vary depending on the stage of the cancer or if a previous treatment did not work. In other cases, the cancer may already be advanced at the point of diagnosis. If your doctor has identified that the cancer has advanced, you will likely have many questions about what steps to take next. The stage and the progression of the cancer will determine the treatment route that is recommended by your doctor, and this will vary depending on your bladder cancer journey so far. Treatment for advanced bladder cancer includes systemic chemotherapy, immunotherapy, maintenance therapy, and targeted therapy. A radical cystectomy is an option to treat muscle-invasive bladder cancer, but is usually not possible if the cancer has advanced further. This video will provide some insight into each therapy route. Please speak with your doctor to discuss these options further and to decide which is the right path for you. Systemic chemotherapy is used to treat cancer that has advanced to parts of the body beyond the bladder. The goal of using systemic chemotherapy is to kill cancer cells anywhere in the body to stop them growing and dividing. Systemic chemotherapy is given as a pill or an injection into the veins or muscles. Systemic chemotherapy can cause the following side effects: nausea and vomiting, loss of appetite, hair loss, easy bleeding or bruising, fatigue. Immunotherapy helps your immune system fight cancer cells by boosting or stopping certain immune responses. For the treatment of advanced bladder cancer, immunotherapy can take two forms: immune checkpoint inhibitors or antibody-drug conjugates. Both of these treatments are given by an infusion given directly into the vein. Immune checkpoint inhibitors boost the body's immune response to therapy by helping immune cells recognize and kill cancer cells. Immune checkpoint inhibitors may be given to people that can't have surgery or chemotherapy due to pre-existing health problems. Immune checkpoint inhibitors are usually given following chemotherapy as a secondary treatment for advanced bladder cancer or when chemotherapy did not work. Some patients who have had bladder removal surgery to treat muscle-invasive bladder cancer may be offered immunotherapy if the cancer returns at a later time. In some cases, an immune checkpoint inhibitor can also be used as a maintenance therapy. Maintenance therapy works by giving immunotherapy as part of a two-step treatment regimen to maintain the benefits of an initial treatment. The aim of maintenance therapy is to prevent the cancer recurring or to slow the progression. For advanced bladder cancer, a treatment regimen of chemotherapy followed by an immune checkpoint inhibitor may be used as maintenance therapy to maintain the benefits of chemotherapy and slow the progression of the cancer. Antibody-drug conjugates are designed to target a specific part of the bladder cancer cells. This means that a treatment can be targeted to the cancer cells without killing healthy cells. Antibody-drug conjugates work to treat advanced bladder cancer by connecting a monoclonal antibody to a chemotherapy drug. Monoclonal antibodies work as part of our immune system to recognize specific parts of the bladder cancer cell. When this happens, chemotherapy can be targeted to bladder cancer cells so that it can find and kill these without damaging healthy cells. This treatment can be used when the cancer has progressed after treatment with chemotherapy and immune checkpoint inhibitors. or for people who can't have cisplatin chemotherapy and have already received other therapy alternatives. Common side effects of immunotherapies include fatigue, nausea, changes in appetite, diarrhea, rashes. Targeted therapy works by targeting parts of the bladder cancer cells that can help them to grow and blocking these to stop the cancer cells growing. Targeted therapy is often recommended for people with locally advanced or metastatic bladder cancer in cases where other treatments, such as chemotherapy, haven't worked. People who receive targeted therapy will need to receive a genomic analysis in order to assess if they have specific genetic mutations that the therapy can effectively target to stop the cancer growing. Side effects of targeted therapy can include mouth sores, fatigue, impacts on kidney or liver function, diarrhea, changes in fingernails and toenails. The Bladder Cancer Advocacy Network is devoted to supporting people impacted by bladder cancer and is here to help every step of the way. There are a number of resources on the Beacon website which can help you to better understand the treatments available for advanced bladder cancer, including the Advanced Bladder Cancer page and treatment overview pages.